Welcome to the 7th Annual Quit Sugar Summit, where the world's leading professors, scientists, MDs, PhDs, coaches, addiction specialists, and health influencers bring you all the information you need to change your relationship with sugar. Now, here's your speaker. Hey, everybody, it's Mike with the Quit Sugar Summit. How are you today? I'm here with Nick Norwitz, and hope I'm pronouncing that right. But
yeah,
he's an amazing young man. He reminds me of my own kids. He's just give you guys a little flavor. He graduated Dartmouth as the valedictorian in 2018 and already has a doctorate in philosophy from Oxford, where his specialty was exogenous ketones and metabolic syndrome and Parkinson's disease. Just currently he's at Harvard Medical getting a doctorate as an MD, and will be finished in 2025. But there's some interesting parts of the story that I'm going to have him tell, that he has a personal vested interest in metabolic wellness, lack of sugar and carbs, that kind of stuff. And his expertise is in ketosis and brain aging, which has got me totally fascinated. So Nick, tell the folks, go back as far as you want, tell them your story, because it is interesting that you ran across physical stuff, and, you know, just, I don't know if that changed the course of your studies, or tell them how that all worked out, because it's pretty interesting.
Well, first of all, Mike, thanks for the generous introduction. I don't think an individual can have greater praise than you remind me of my kids. I don't know your kids, but I presume that's a very high compliment. So thank you. Yeah, looking back on the past couple of years with my own health stuff and in this exploration into nutrition and metabolic health, I still can't wrap my head around how much my perspective on medicine and health and healthcare has changed. If you had told me before all of this that I would be interested in nutrition, I would have told you that's a fluffy science. I like hardcore stuff, right, and to go play with your MyPlate, quite honestly.
Well, that's a great one.
Incidentally, I'm now sitting in meetings where they're like, "We're going to teach nutrition. Here's my plate," and I'm just like, "Oh no!" But we'll get to that.
Right.
Anyways, yeah, I was, on the surface throughout my entire childhood, a very healthy looking kid, athletic, lean, I never had a chubby phase even. Mm-hmm. I, played a lot of sports, soccer, basketball. I ran. I was just like one of those kids that has a ton of energy, bounces around, and quite honestly, seems pretty resistant, genetically gifted, however you want to say it, against gaining weight and looking unhealthy. Mm-hmm. So because of that, I, quote, got away, or thought I got away with being more relaxed about my diet. Now, the thing is, I actually come from a family of doctors. Both my parents are MD, PhDs. So, general health and wellness was in the atmosphere, in the environment. It wasn't like I ate McDonald's every day. Yeah. In fact, I ate a pretty, quote, balanced diet. I ate a lot of healthy whole grains. Tons of fruit. I love fruit. And then things that are presumed to be healthy, like fortified cereals, part of a balanced breakfast, that are, advertised as like, oh, Special K with real berries or dried fruit. I literally, as a little kid, probably 90 pounds, 10, 11, 12 years old, after eating carbs all day, I'd be sitting in bed at 9 o'clock after dinner, probably after having ice cream, and thought it was a healthy decision, as did my family, for me to be snacking on, those like orange flavored craisins, the dried cranberries.
Yeah.
One pack. I'm like, oh, it's dried fruit. I look at it now, it has 128 grams of sugar.
Right.
It's 32 grams of sugar per serving. There's 4 servings, and I'd be just snacking on that before going to bed. And that's kind of how I ate cereals, whatever. And I thought I got away with it. And I got more into the nutrition and or again, I'm going to put quotes around a lot of things, people that are just listening, quote, nutrition, when I got into sports. So when I got a little bit older and got into endurance running, I became more focused on my nutrition and what I thought were or healthy dietary patterns. To fuel my exercise, I thought, okay, I need to eat lots of small meals. I need to fuel my exercise with carbohydrates. So targeting carbs around meals, eating like lots of Cliff Bars, peanut butter, tons of fruit, bananas, oatmeal, X, Y, Z, lots of it. I was probably having like half a kilo to 0.75 kilos of net carbs per day, but I was also extremely active, running 80, sometimes 100-mile weeks. I was the kid that like on Sundays got up, ran 20 miles, then went to the gym. So I maintained what looked like a good physique, and I felt healthy until things started to fall apart. And I'll cut to the chase because I've explained my story elsewhere, and I really want to get into the nerdy stuff with you, Mike, which people might find more valuable. But when I was between the ages of around 18 and 24 was when my health started to fall apart, and I kind of had a reawakening moment. So when I was 18, by this point, I was running sub-3 marathons. I was, winning races. I qualified for the Boston Marathon in 2014, and I was prepping for that race when 6 weeks before I got a pretty bad fracture in my tibia, which was my first ever bone fracture. In fact, that year I'd ran like 3,000 miles without any problems. So I didn't have congenitally low bone density. Like I didn't have any defects in my history. No reason to think that I would have a bone defect. But the injury had trouble healing, and over the years, my bones got weaker and weaker, as evidenced by having more and more fractures. In fact, the pattern was so weird, and it was so outlandish to imagine that I, who looked healthy, normal BMI, but not too skinny. My BMI was like 21. Normal testosterone, everything was normal thyroid. It was, and no genetic markers, no family history of, say, osteoporosis. Why would I have issues with bone density? So for years, bone scans kept getting pushed off like, this is not possible. This is not possible. Eventually, I did get a bone scan after quite a bad fracture in my foot, and it revealed that I had full-blown osteoporosis, which was very weird for a healthy, at that point, 20-year-old guy to have, be in the lowest percentile for bone density. I had the bones of like a 70-year-old woman or something. It was kind of scary, and for me, a little bit traumatizing, considering something that I love. Sports was something that I loved, and to say that your bones are so weak that you might never even run again, I was just like, well, you can imagine how that hit me.
Yeah.
Eventually, I came to terms with it and figured it was just a fluke. I didn't know why it was, but it is what it is. So I came to terms with it, and after that, I started having other metabolic issues, including terrible gut problems. So pain after eating, and that was also hard for me because I was, in combination with being an athlete and a real foodie. I love to cook. I cooked dinner in my house every night when I was in high school. I just loved it. And I would try anything. I had no food aversions in the world. Like nothing could gross me out. I would go places and try anything you could imagine. Food was something that really brought me a lot of pleasure. Experiencing different cultures, going out and having meals with friends, all that. But then I started having gut pain after basically everything I ate. And there was this changed relationship with food where not only did I not enjoy it, but it brought me anxiety. Because, if I go out, I have to, eat. And if I have to eat, then there's going to be, let's say, downstream effects after that in social settings that make for embarrassing and uncomfortable situations. And that started to dominate my life. This was at the end of college, where I was trying to cover it up as best I could. But it's, I think I did a pretty decent job, but it made it pretty much every day and every social experience pretty tough. Even normal college things like taking an exam. The anxiety provoking thing about an exam for me was not the exam. I didn't really get anxious about tests, and I was a pretty good test taker. But I would actually have a lot of anxiety beforehand because I'm like, well, what if my like stomach starts acting up mid-exam? Like, how am I going to deal with that? Am I going to have to run out of the room and be embarrassed in front of my classmates? What am I going to tell my professor? All these things. Same thing at the dining hall. Same thing anywhere. And I just kind of persisted because I didn't know what else to do. And then things hit a climax after graduation. So after I graduated from Dartmouth, I went to Oxford to do my PhD. And as soon as I moved there, shit really hit the fan. Pardon the pun. The colitis got really, really bad.
Right.
Coincidentally, concurrent with me eating a lot of fudge because I had just moved into a apartment that was right next to a great fudge shop in Oxford, which
Goodness,
was
yeah.
I just like I patronized them every day, and at this point, it was kind of encouraged because I was a pretty lean person, and one of the hypotheses prevailing for why my bone density was low was something called relative energy deprivation in sports, REDS, which is it's not an eating disorder per se, but it's in the same family of conditions. In fact, it's spun out of what's called the female athlete triad, which is when women restrict intake um, relative to their energy needs, they have loss of menses and they have low bone density. So that was kind of what's called the hypothesis or the diagnosis of exclusion, because nobody was able to figure out anything else with me. I didn't really think it fit because I have normal BMI, normal testosterone, and I was drinking jars of Nutella basically. But nevertheless,
Right.
they're like, okay, maybe you need more energy in your diet because you have such high energy needs. So I was encouraged to, have calories at all costs. And quite honestly, if you're a kid and your medical team says
Keep more
eat a lot of
calories.
food and fudge is okay, then you're like, okay. It only capitalizes on the food environment we're already in, which when it comes to especially young male culture, college male culture, I just finished college, there is quite honestly a lot of virtue signaling around food. I mean, we even see that we all see that. We see that in Twitter. It's like, how many pictures of people's meals do you see? Yeah. I quite enjoy them, but food is such a nucleus of culture now that there's just like virtue signaling around food everywhere, right. And hyper palatable indulgent food. And so, reflecting back, I was very much susceptible and giving into that pressure from all sides. It's like eat, and yeah. Anyway, that's a tangent.
It's a good one though. The fudge tangent.
we can come back to that topic because I think that food culture aspect is interesting. But anyway, there was this one night, which I'll never forget, where I had a severe gut pain. And for anybody who's ever experienced gastrointestinal pain, like in colitis, which is the condition I had, or Crohn's disease, or just severe IBS, in my experience, there's nothing quite like it. I've shattered bones, and quite honestly, I'd rather just break my own femur than experience this sort of pain. But anyway, I was rushed to the hospital, an NHS hospital at 2 a.m., complaining of really bad gut pain, but I was never treated for the gut pain. And in fact, it was just passed over when they incidentally noted that I had severe bradycardia, which means a low heart rate. And as a point of reference, bradycardia threshold is below 60 beats per minute. And my heart rate was in the 20s. That is not like Lance Armstrong, healthy level, low heart rate. That is like, yeah, this is a problem. This is a real problem. So they ended up putting me actually in a palliative care ward. Now, I don't necessarily think I was dying, but it's the NHS. They didn't have many places to put me, and they wanted to keep me as an inpatient. So then I spent 3 days in palliative care, probably the youngest person there by like 55 years in the palliative care ward. And that had a real impact on me overall. I mean, I'm grateful I was put there because of the shift it caused in my mind, how seriously it made me take all this. But I was sitting there for 3 days. I actually couldn't sleep because of all the alarm beeping and people screaming around me. There was a lot of people with like dementia, so they'd scream weird things and all the codes and XYZ. It was quite uncomfortable. But after all that, leaving that ward with, again, no legitimate answer as to what was going on with me and feeling so incredibly depleted and quite honestly depressed, maybe not clinically, but I felt depressed. I returned to my dorm and I just then lay in my bed. I had no energy to do anything else and reflected. It was actually on my 20th, it was my 23rd birthday. I remember laying there. It was not a, I was like, I'm 23 years old. And in the past few years, I've gone from being a healthy hot shot who could run a half marathon in 1:15, and I held 2 state push-up records. I was a good academician and had a lot of promise in my future. I was at Oxford doing a PhD. I had a place at Harvard Medical School. I was so excited and about my future, and yet it all felt kind of intangible to me, because now I was at a point where literally getting up and walking to lab was a struggle. Marathons were out of the question. I literally, like, rolling over in bed took effort. I remember laying there kind of getting like sore on one side with a hot beanbag over my stomach and being like, I know I want to roll over, but that's a lot of energy. And I felt just quite horrible, and I didn't know what to do. And I just felt confused because of all the things that had happened. And also, I mean, desperate and hopeless, because at that point, I mean, I'm not much older now, but I felt I wanted to be a child in a patriarchal, like, or paternalistic medical system where I go to my doctor and they're the brilliant people who are supposed to heal me. That's the way we think about medicine, that the doctor's omniscient, they know anything. Listen to the doctor, they'll make you better. And that's a really, really nice fantasy. It's a one I really wanted to believe in, especially because I held and hold doctors in such high esteem for what they do. And both my parents were doctors. And I'm like, if they can't help me, who can? Because I definitely can't help myself. How many years of training do they have? How much expertise do they have? And I'm seeing subspecialists who are the best in their fields. So wouldn't it be incredibly arrogant for me to be like, I can fix myself? And I guess that was what was going on in my subconscious. And one of the reasons, in addition to just like everybody else wanting to just live my life and not have to focus so much on my health, that things had gotten to the point they had gotten. But I think, like a lot of other people, at that point, you become so desperate that it becomes your only option to be like, I'm going to try to figure this out. Like, I don't think I'm going to be able to. Why would I be able to? But my options are die, which didn't really appeal to me. I definitely wasn't suicidal. Live a horrible, suffering life. Probably not get my MD or my PhD, or just try to figure this out for myself. So I started to read and experiment with alternative therapies. And after a lot of experimentation, I came to near the bottom of my list of possibilities, which was ketogenic diet. And at that point, I had a lot of biases against ketogenic diets, like everybody does, even though I had read a lot of the literature. And at that point was studying exogenous ketones in a particular disease. And I thought it was very niche. So I didn't really think about applying it to myself, but I'm like, all right, I'm going to try this. Why not? Let me just give it a real go. And, well, I think you can guess what happened. And my only regret is I didn't try it sooner, because, yeah, it was about a week later. I felt myself again. And I never thought I'd feel that way. I had so much mental energy, like I wanted to work. I was just buzzing and happy, and my gut felt incredible. Like I had no colitis-like symptoms. All the blood had gone, the terrible pain had gone. There was a little bit of bloating, but like compared to what it was nothing. And the inflammation marker dropped phenomenally, about 8-fold into a normal range. And after that, it just, I didn't have confidence it would stay that way, but it did. And after a while, I started just titrating my meds down, not really consciously, but I'm like taking the pills. I'm like, do I need this? Meh, I'll take a smaller dose. And eventually I came off of them. And the inflammation markers, they never came up. And the only time I've ever had an ulcer since that point was when and I've tried to reintroduce carbohydrates, quite honestly, several times. But when I pushed it to the point that I was out of ketosis for about 36 to 48 hours.
Okay.
And that was the only time. Immediately I had blood in my stool again. And it wasn't like I was having sugar. I was having like a larger volume of cooked beets and basically like, things like carrots and sweet potatoes. Like
Okay.
these were quote healthy carbs, blueberries, and just to a volume that I was out of ketosis. So, for me, I do think ketosis is therapeutic. Now, just it's definitely not for everybody. I don't think everybody needs to be in a ketogenic diet, but that's my narrative. And currently, yeah, I'm on a ketogenic diet 24/7, and if I have to be that way for the rest of my life, I'm only too happy because I have the perverse privilege of having a point of contrast that makes me appreciate how important health and metabolic health is that I don't think many of my age cohort do. And so, now when I get up and have, don't feel amazing every day, but when I feel pretty good, it's not something I take for granted. And that's where I am right now. I'm really, really happy, over the moon happy that I have my health back, that I'm continually improving, and even more excited about the fact that now I have this background, this enthusiasm, this energy to bring to my medical studies, my future research studies. It is now my self-prescribed purpose to make metabolic medicine mainstream so that people don't have to go through the same story arc that I went through, which I will tell you is not unique.
Yeah.
I am not unique in any respect because, and I think you can, everybody listening to this Quit Sugar Summer, or most people can probably appreciate this motif of a patient struggling with some metabolic health condition. Mine were a little bit zebra-ish, a little bit odd constellation, but a lot of people are struggling with various things, even if it's just weight. You can say obesity is a metabolic disease, and you're trying all the conventional routes or all the conventional medicine routes, and it's not working. And then, some brave people, hopeless people, desperate people, whatever your motivation, experiment with other things. Usually not because they necessarily expect it to work, but they're like, this is interesting. Or maybe they saw someone who it worked for and they try it and it really works. And then there's all this energy to share their experience with other people because they know how powerful it can be. And now I'm in a place where I don't understand how metabolic health. I used to think this was roofie stuff, and now I don't understand how it's not frontline medicine. And making it frontline medicine is really what I want to do. But I'll shut up now because I've been rambling a little bit.
No,
And
it's been
you can go to whatever topics you want.
wonderful. I really appreciate your honesty and vulnerability in this. It's not something people share often, and a lot of people, 70% of our people are brand new, so they've never heard your story. So yeah, no, I appreciate that. It really has been enlightening for me, because a lot of it I didn't know. I knew some of it, but I didn't know all of it. So the question always everybody asks, and I want to get it out of the way quickly. During that time period where you decided, and I'd like to know, your sugar intake in general, but did you have withdrawals? Did you have a difficulty giving up the carbs? Was it psychologically, physically annoying? What was the arc of getting from the diet that you were on to the diet you settled on? Was it, people can't seem to get from one place to the other, even though they want to.
Yeah.
Something holds them back, an addiction, a draw of some sort. So what was your experience?
So I want to preface this by saying my experience is what I consider to be very atypical, just because of the kind of person I am.
Yeah.
And the point of contrast I had. Like, I felt so shitty all the time. It's like not like I had any desire to eat anything.
Yeah.
I didn't want to eat. So my experience is a little bit different. For me, I'm a cold turkey person. I need to have a challenge and commit to it.
Okay.
So actually, interestingly, when I started trying to go below 100 grams of carbs. I thought I would titrate it, and I actually found that difficult. I had trouble getting below 100. And so, knowing myself, I said, all right, you know what I'm going to do? Below 100 is too hard, so let's do below 20. Because I know, like, if I have a real challenge that like I perceive as a challenge, and I'm going to step up and complete it because I just love challenges. So I actually found going from a high carb, high sugar diet straight to keto for me worked better because I have one of those personalities where the pain doesn't bother me. It's the I don't know, my psychology. Also, I don't think I was particularly insulin resistant.
Okay.
I had pretty low fasting insulin levels, eating all those carbs. So, I think any degree of sugar dependence for me was probably mostly psychological and habitual.
Okay.
Maybe metabolic in other respects, but not to the extent that I think other people genuinely have a sugar addiction and dependence. And I definitely believe that is a genuine phenomenon. So I think for most people, that transition might be better facilitated in by a stepwise manner. But I mean, the straight answer was, yeah, I went cold turkey,
Okay.
cut out everything, and
Yeah, I find athletes, especially extreme athletes, can get bounced back pretty quickly. So they have a substitute for endorphins and dopamine and
yeah,
stuff. Yeah, for
yeah.
sure.
I mean, yeah,
But I mean, I've heard you talk with Jen Unwin and Clubhouse and different folks, and Bitten's been on, and all these folks are on our summit too. But what are your beliefs around sugar addiction, or people who do have a large habit who have a difficult time getting off of it?
yeah. I think the first thing to do is that to recognize it's an addiction, um, and what the implications of that are, both biologically and environmentally. So I mean, I guess the first thing to start talking about is the rationale for it, whether or not sugar is an addictive substance.
Right.
And I think there are multiple lines of reasoning to argue that it is. One, just the neurobiological imprint on the brain and the neurocircuitries that it activates, which are very similar to drugs of abuse.
Yes.
Things like cocaine and amphetamine, they activate the same regions in the brain. In fact, in rodent models, you can cross-sensitize rodents to substances of abuse and sugar. So say you give them amphetamines or cocaine, they'll work harder for sugar, and vice versa.
Mm-hmm.
There's also neurological adaptations, changes in dopamine receptor expression.
Right.
So that you have like a repression in certain feedback cycles, depression in the impulse and control centers of your brain. There's even been human studies looking at this via fMRI, functional magnetic resonance imaging, looking at people who score on adapted versions of the Yale addiction scale or something for food addiction. Yale food addiction scale, I think, something like that. And the people that score higher, they have decreased activities in the regions of the brain that help with, say, impulse control and management. Interestingly, though, in these studies, the people have not necessarily, they don't have a greater response to the food. So in one study I'm thinking of in particular, and I can't remember the author, I remember it was done in young women, and basically the protocol was you're going to take people and you're going to put them in an fMRI scanner, and you're going to give them a cue for an incoming stimulus. In this case, the cue was a image of a chocolate milkshake made of, I think it was Haagen-Dazs vanilla ice cream and Hershey's chocolate syrup. So that was the formulation, or water. And then later you put a drop of the milkshake on the tongue, or you put a drop of a tasteless solution that mimics saliva on the tongue.
Mm-hmm.
And what they find is that people who score higher on the food addiction scale, they have much more robust activity. Anticipation, specifically in anticipation to the stimulus, even though when the stimulus is delivered, they might not have that much of a response. Now, the reason this is interesting is a broader point that there's and I won't go too much into the neurochemistry of this because it's a little bit complex, but there is a disconnect between wanting and working for a food and craving a food and actually liking the food, enjoying the experience of that food. Those things are separate and not proportional. And I think that's something that is really difficult for people to wrap their head around. We just assume, like, I really, really want that donut. I really want that cake. And then you eat it. And you presume you're liking it in proportion with the degree that you wanted it, but that's not the case. At least speaking neurobiologically, when you're looking at brain activity, and it makes sense, right? That why would evolution doesn't care how much we like something. Evolution cares how much we work for it, and it makes place to displace the reinforcing stimulus, say the dopamine hit, from receiving the stimulus to actually anticipating it. And you can even see this in Pavlovian conditioning. So maybe people remember from like high school psychology, Pavlov's dogs. This is a very famous experiment where this guy, Pavlov, he had dogs, and you give them meat and the dogs are going to salivate, right? And he'd ring a bell before he gave them meat. And that would train them, it's called Pavlovian conditioning, to respond via salivation to the bell prior to the meat. And our bodies do this too. They learn to associate. And so now we have a lot of responses, dopamine spikes in response to anticipation of stimuli and exposure to stimuli. And in our food environment, you can imagine what that means, because it's basically possible to avoid these hyperpalatable, highly processed and often very sugar-filled foods. And so you're getting this drive, the Pavlov's ringing bell all the time, making you want something, and eventually you're just going to give in until you can break that cycle. And what follows on that, I'm now gonna coin the term for the first time here and now, the blueberry effect.
Okay.
Because this is maybe one of the strongest selling points for being sugar abstinent. And I'll tell you why I call it the blueberry effect. So when people go, well, let me ask you, Mike, do you ever get that reaction when you tell someone you don't have any sugar or any sweets? Presuming you don't, maybe you do, but if you don't, okay. So you're like, I'll never eat ice cream, or I'll never eat bread. And they're like, wow, you're so strong-willed. I can't imagine how you do it. I die without cake, or something of that effect. Where it's like a pitying, like, how I can't believe you're living without this.
Exactly.
With that, and I think everybody in our space gets that. If you're completely sugar abstinent, people think you're like super strong-willed, and you're basically depriving yourself for your health. Whether or not they think that's admirable or weird, and I think most people might think it's a little bit more weird, they don't. It doesn't quite click with them that, at least for me, and maybe it's for you, it's different. You have no drive for it.
There's no drive. Zero.
There's no drive. It's gone. And it's like, I don't want this. And I now enjoy simpler foods more. It's the reason I call it the blueberry effect, is that I've worked with people, and I've had this own experience myself, but I'm thinking of one person in particular that's, after being completely sugar abstinent for a while, had some blueberries, and they're like, this is the most remarkably sweet thing I've ever had in my life. And this person, and me as well, and I've experienced this, used to eat like, a Haagen-Dazs ice cream by the pint, drink Nutella. Like, my dad goaded me into, when I was like 11, eating a 12-person ice cream. I was like 100 or less pounds, 11-year-old, and I'm like, I can do this. And that was just like how I lived, eating a ton of sugar, and I thought I really loved it. I thought it was a pleasurable thing that I couldn't live life without. And it's such a weird thing that you can't wrap your head around until you've been sugar abstinent, that you can have some blueberries or anything that's even just remotely sweet, a tiny piece of 90% dark chocolate, and enjoy it, perceive more sweetness in it than the most hyperpalatable food in the world. And it's because the sweetness, the enjoyment, the palatability of a food is not an intrinsic property of the food. It's not an objective property. We think it is, but it's all about perception. And when you fix your metabolism, your neurometabolism, your peripheral metabolism, to a point where you register food like you're supposed to register food, then simpler foods become so much more enjoyable. Like, quite honestly, I like one of my favorite meals, and I have it for dinner almost every night, is like eggs, salmon, and olive oil. And my parents are like, "Do you ever get tired of that?" I'm like, "No, I really enjoy it. It's like easy for me to make, but like I love it. It tastes so good to me." Or when I have like some scallops, now I taste this immense sweetness in the shellfish, and weirdly enjoy my pretty simple diet now more than I ever did my hyperpalatable diet before. But most people are locked into this place where they think they need the hyperpalatable foods, but that's their point of reference. And in the end, what that means is there's a dependency, and it's more of a relief than a pleasure when you have that food. It's like, does it actually feel good to burn your finger then run under cold water? Is the cold water feeling good, or is it just relieving the pain? Relieving, in this case,
so do you believe that it could possibly be the dopamine reaction that the hyperpalatable food initiates that is the reason that they're drawn to it, as opposed to obviously actual hunger or satiety or nutrition, and that they're actually, it's a substance use disorder, and that their dietary, their mouth, their stomach, their taste buds have all been hijacked to the point where this is their delivery system. It's not smoking, it's not injecting, it's not drinking alcohol, but it is eating this product that actually they're looking for a dopamine hit or every other feel-good brain chemical reward. Do you think that that level of substance use disorder is something you're willing to go out on a limb and talk about?
Yeah, I don't think that's far-fetched at all. I don't even think it's that controversial that people self-medicate with ultra-processed foods. It's like, I had a stressful day. Right. I need some sweets to calm me down. It's become an acceptable thing to do. And it's also taboo to criticize that approach. It's taboo to say, like if somebody said, I had a really hard time today, or let's take an extreme case. Let's take, a lot of doctors are unhealthy. Let's take a doctor who is maybe a like high risk maternal fetal medicine obstetrician, and they're delivering like babies from high risk pregnancies, and they have like a horrible case where a mother and a baby dies, and then they just feel horrible, and then something terrible happens at home, or they crash their car and they get back and they're like, I just hate life. I just want some ice cream. I just want to like go to sleep. Like people have hard lives, and I want to accept that. Like, people live stressful lives, and in those scenarios we often turn to food because it's comforting, and because it just seems like such an innocent thing. Each little instance seems so innocent, and you're not going to criticize someone when they have a hard time. You'd be a jerk to do that. But it establishes a pattern that overall is harmful. And more broadly speaking, and this is one of the really interesting things about sugar as an addictive substance, is with most addictive substances, there's a social scrutiny and a taboo in indulging in the addiction. If you see someone smoking, your thought is quite negative. And I can comfortably at least give them a dirty look and say you shouldn't smoke. Quite honestly, I have no problem criticizing that. With sugar, it's the opposite. This is a substance of abuse that abstaining is the thing that is socially scrutinized. If you're in a office party and you're like, I'm not going to have the donuts, or you're at a birthday party, or it's your birthday and you won't eat the cake that your grandmother made you, then you're a party pooper. Like, you're like some schmuck. Like, what are you doing? Like, just indulge. Why are you making it awkward for everybody? It's a really interesting social dynamic. And I think that's one of the biggest things that hinders people from getting started, is it's too difficult to get away from that social awkwardness of not having any sugar. And when I say sugar now, I mean sugar in a more broad sense, including, refined carbohydrates, bread, etc.
Especially, I'm so happy you're bringing the social up. It's so important. It's so important. People don't realize, and you're describing it very well. It's exactly what happens.
It's a barrier to people really, because I do think if people have experienced the blueberry effect, they'll never go back. But to get to that point, you have to kind of to buy in and recognize and compensate for, because they're not easy, the societal structures that we have. Sometimes just by recognizing something and holding it in the forefront of your mind, you can kind of accept that you have a choice that you can compensate for. So it's like, for me, for example, the choice is pretty easy for me. Not everybody knows about my health stuff. So if I go out to dinner, I don't go out that much, but my options for ordering are very limited because actually I have now a lot of food restrictions. And so what are my options for ordering? I can basically get a grilled steak with, I can't even have really A1 casein, so not butter, but maybe I bring my own olive oil, which is a little bit awkward, or I bring my own ghee, which is a little bit awkward, or I get a steamed lobster with poached eggs or something like that. Mm-hmm. And that's kind of what I have to order, or I fast. I have no problem eating before I'm fasting, but that inevitably makes a difficult social situation. And so, and for whoever it is, it's going to be a difficult social situation. So you, as an adult, have a difficult decision to make. Do you want to prioritize your health, or do you want to avoid the awkwardness? And I'm not saying it's an easy choice. And I'm not saying there is a right answer. It's your prerogative to make whatever choice you want, but you should make that choice with full awareness of what you're doing. If the person across from you decides to have a dessert, it might be awkward for you to say, I'm not going to have any, or the office party scenario. Is that awkwardness worth it for you to improve your health? And if it's not, then fine. You have the authority over your own decisions to make that choice, but just realize that you're making that choice. Mm-hmm. I guess that's where I'd start with people, because I don't mean to be prescriptive, but I think most people go along with it mindlessly. And like I said, it generates a pattern that makes people wake up when they're, 40 and they can't see their toes. And then they end up getting diabetes, XYZ. It's like, it isn't worth it for most people if you really stop to think about it. Yeah. The alternative is a lot better, even if it's sometimes socially awkward.
Right. So let's transition a little bit to one of my favorite topics, and obviously one of yours of study, is brain health and brain, the effects, long-term, short-term, all the effects of ultra-processed carbs on the brain. Is that, I mean, I'm not going to get your entire PhD in 5 minutes, but I'm curious about, we've got, I don't know if you know this guy, Richard Johnson. He's got a new paper out about fructose. And I've talked with Dr. Lustig and Dr. Fetke and this about fructose, the possibility of fructose being a psychoactive drug or affecting the nucleus accumbens in a different way. We all know what the glucose is doing, metabolic syndrome, blah, 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 the body, and diabetes type 2 and everything. Mm-hmm. But why is the brain affected? Do you believe diabetes 3, this kind of construct, that that possibility? I mean, is there a correlation? Do you believe to the sugar and the Alzheimer's? You studied Parkinson's, I believe. So tell us, give us. I know you're doing an excellent job, not like diving real far into the science, but giving real down to earth answers for folks so they can understand them. So tell us what your thoughts are on the brain, because I want to tell you something. Of all of the benefits that people get when they get post-abstinence, I don't care if they've lost 100 pounds, if they put diabetes 2 in remission, the number one thing is always the brain fog clearing, the processing better, the better memory, the better sleep, the things that have to do with, the brain than more than the body. So I know that's a big, giant topic, but do the best. You're doing great on the social thing. You nailed it, which people needed to hear. So see how you do on that one. I really think it's so important.
I mean, where to start with the brain? I would say, first of all, just to with respect to fructose and the hypothalamus, I don't know specifically about fructose as opposed to glucose and hypothalamic activity. But when you said that, it didn't make me think about an illustrative study by Kullman et al., Kullmann, I think, 2020, that makes the point that brain metabolism and whole body metabolism are interrelated. So I don't want people to think that the blood-brain barrier is some impenetrable barrier. Quite honestly, the brain and the body need to be thought of as one unit. I am by trade a neuroscientist, but I have now I spend a lot more time reading peripheral metabolism papers, not because I don't think the brain's interesting anymore, but because I just realized that this is all one thing. So anyway, this paper, I think people will find it interesting. It looked at insulin resistance in the hypothalamus, and people's ability to lose and maintain weight at 24 weeks after a lifestyle intervention, or maybe it's 24 months. I think it's 24 months, which is 2 years, and 9 years. And what they found is that people who had insulin-resistant hypothalamuses, which will roughly correlate with peripheral insulin resistance, which get measured in a HOMO IR, and we can talk about that in a minute. But insulin resistance in the hypothalamus predicted weight gain at 24 months and 9 years. And this is probably the most interesting part for nerds like myself and you, is even controlled for BMI, insulin resistance in the hypothalamus preferentially biased excess weight storage in visceral fat. Visceral fat's the type in your abdomen that is very inflammatory and unhealthy. So there are multiple stores of fat in your body. You have your subcutaneous fat under your skin, which is actually quite healthy, even if it's not aesthetically appealing. And then you have visceral fat in your abdominal cavity. It's really the visceral fat that's problematic. Generally, the two, will more or less correlate, but not necessarily. And so what this study showed was that there was a preferential increase in visceral fat with hypothalamic insulin resistance. And what one can conclude from that is the broader point that dysfunctional brain metabolism screws up the way your body manages excess energy and excess calories to put it in maladaptive stores. So, with this like energy balance model, really the issue is not, do you have an excess of energy? It's how much calories you eat, or how many calories you eat. It's like, what do you do with them? And when you have insulin resistance, even just in the brain, it can cause you to, say, store calories in a very unhealthy manner that generates inflammation, inhibits the generation of more muscle tissue, because that's what visceral fat does, and then starts a feedback cycle that might not be seen in a short span of time, but is seen over the long term, and that's our concern. Also on the topic of fructose, one thing fructose does do, I know, is that it now we're talking about different fat stores, sensitizes fat to the effect of cortisol, the stress hormone, which is interesting because cortisol has different effects on different fat stores, where it promotes lipogenesis in visceral fat, gaining of fat, and promotes lipolysis in subcutaneous fat. So in effect, one could argue, and I have this argument from Ben Bickman, who I'm sure you know, a brilliant scientist, that in effect fructose could help traffic fat from healthier subcutaneous stores to unhealthy visceral fat stores, generating inflammation XYZ. But I'll put a pin in that because you were asking about the brain. And what I will say is, the brain health, I would measure it in cognitive longevity. Most young people, the brains operate pretty well. But it's like, how long can your brain operate well? Nobody wants brain decay. And I think the scariest diseases are those neurodegenerative diseases that I study, Alzheimer's and Parkinson's. And so if you think of your brain in that light, then you want to do everything you can to make it run clean and efficiently. And what that means is keeping it insulin sensitive, keeping it, with a good capacity to take up and utilize glucose. Cerebral glucose metabolism, which is impaired when you have an insulin resistance brain or an Alzheimer's, etc., or when you're insulin resistant in general. Keep your inflammation low and give your brain a source of fuel that helps it run cleanly. And so we can touch on each of those things. I'll start first with type 3 diabetes. So type 3 diabetes, as you mentioned, it's an alternative term now used by some people for Alzheimer's disease, because in the Alzheimer's brain, there is insulin resistance and decreased cerebral glucose metabolism. So similar to peripherally in diabetes. And this can be brain specific, but cerebral glucose metabolism decreases are seen very early in Alzheimer's disease, and they do correlate with insulin resistance as measured by a HOMO test. So you definitely don't want to get insulin resistant in your brain, because it's not just about glucose uptake. Insulin is a very important hormone for all sorts of different things. It's a growth factor in the brain. It helps modulate neurotransmitters. And if you really want to get into the nerdy aspects of it, I do have a paper called the multi-loop model of Alzheimer's disease, where we talk about Alzheimer's, Parkinson's, Wnt signaling, and insulin resistance, and how all these things are interrelated in this complex soup that I will refer you to that, because I'm not going to go down that rabbit hole. I have a tendency to ramble, as you probably can tell.
You're doing great.
Other things I would point out is inflammation is a huge factor and probably a necessary component of most neurodegenerative diseases, especially Alzheimer's disease. So a brain without inflammation is probably a brain that's not going to get dementia. In fact, you can have a high amyloid burden in the brain, but if you have low inflammation, you probably won't get Alzheimer's disease. And that's mediated by microglia. And I'll just say having low sugar is probably going to promote a healthier metabolic state and a lower inflammatory state in the brain, and leave it at that. And then what was the other thing I said? Inflammation, insulin resistance. There's a lot. Providing your brain with a clean source of energy. Right. And this relates to sugar reduction, but I would say that I think providing your brains at some point in time with ketone bodies, either being on a ketogenic diet or doing cyclic keto or intermittent fasting, is probably going to be beneficial for your brain, because that's why we're really good at making ketones, because we have big brains. If you think about it historically, it's just like when we were evolving, if we had been deprived of carbohydrates, which we often were, our body had really two options: to break down lean muscle tissue to supply glucose to the brain, because the brain really only eats glucose and ketones, or to become really good at making ketones to fuel the brain. And so we became the best animals at fueling our brains. Incidentally, other animals with big brains are also relatively good at ketosis. And when babies are developing their brains, neonates, they are really, really good at going into ketosis. You take a neonate and you deprive it for food for like 3 to 4 hours, they will go into deep ketosis. All that said, though, the benefits of ketone for the brain are twofold, having to do with the dual nature of ketones. One is that they're a really clean and efficient energy source. If you want, we can talk about redox bands, XYZ, but one way to think about it is like a brain running on sugar is kind of like a Hummer H1, running on gasoline, not very efficient, kind of dirty, makes a lot of waste products that in the brain can cause damage over time to the engine. And a brain running on ketones is more like a Tesla Roadster. It runs faster, runs cleaner, and I love Teslas, in part because they have those really cool handles that like sit inside the car. I don't understand. Anyway, and then the other aspect of ketones that are great is not that they're just a metabolic fuel. People talk about that a lot. They emphasize clean fuel. The ketones have a dual nature as also really potent signaling molecules. They are hormones. They have receptors all over the body, and do a lot of different things. They bind to receptors on cell surfaces. They go inside cells to inhibit histone deacetylases, change gene expression. They themselves, especially beta hydroxybutyrate, are post-translational modifiers on a lot of proteins. So you hear about these regulatory cascades like phosphorylation or acetylation or methylation. As it turns out, beta hydroxybutyrylation is a thing, and at least, I think on last count, 1,396 different proteins are independently modified by beta hydroxybutyrate. So they revamp brain metabolism completely, beyond just being a fuel. They rewire the metabolism, and you don't need to understand all the ins and outs. Nobody does. I definitely don't. But you'll know what I mean when you experience what you were talking about, that lifting of brain fog, that keto brain where you're like, whoa. Or if you ever go into deep ketosis and you wake up one morning and you're just like, I feel like I've done 10,000 hours of meditation and I'm a Zen monk. You ever like wake up and you're just like, I know I'm in deep ketosis. At least I'm like, my brain just feels that way.
I love it. Nick, I have a question.
It's a cool feeling. So
I have a question about inflammation. Is there a simple test people talk about inflammation in the joints all the way to the
Yeah.
brain and everything in between? Is there a simple thing that people can know how much inflammation they're experiencing?
That's a really good question. I'm gonna unfortunately say no. The tests typically people would order is an HSCRP or a CRP, which is C-reactive protein.
Yeah.
It's a general inflammation marker. I would say a positive, so a high level, means you have inflammation, but a negative doesn't necessarily mean you don't.
Right.
You can have a low HSCRP and still be quite inflamed. Inflammation is such a complex process in the body.
Okay.
Just to describe it very briefly, because I know it's a little bit of a fluffy term. The way to think about it, I think, is like the immune system is like the body's army. It's good. Inflammation isn't a bad thing. It has its purpose to defend us against invaders. But chronic inflammation. So when we say inflammation, we're talking about chronic low-grade inflammation. It's like your body's army being on high alert all the time and being always active. So it's like your army on your home turf, kind of like being active with your guns locked and loaded, shooting your artillery off every now and then, throwing grenades, XYZ, all over the place, even locally. So it might not necessarily be picked up systemically, but it could be locally in a particular region, like say in the gut. Right. It can be local inflammation in the gut that's hard to pick up. You wouldn't necessarily pick it up on HSCRP. If you have gut issues, you could get something called calprotectin. But there are so many complex hormonal mediators, different interleukins and cytokines, and to be realistic, your GP or PCP is probably not going to order complex cytokine panels. So
is skin inflammation like a acne or rashes or something? Is that like an indication, or are there like signals? Obviously, pain or whatever in your knees or whatever.
All these things are interrelated, and the reason I'm hesitant to give recommendations for more complex tests to assess inflammation is that the best thing to do to assess inflammation is the things you just mentioned: the pain, the rashes. All these things are inflammation, and to some extent, most of the time, or at least it's productive to take that presumptive perspective and try to address these problems in the way that you would address inflammation, by potentially reducing the inflammatory or triggering foods in your diet. And that's different for different people. So sugar is definitely one up there at the top. Processed seed oils are another. Really anything packaged or processed. Other people really have trouble with dairy. Right. One thing I'm really interested in is actually dairy chemistry. Written blogs on it, but cutting. I've literally had people with inflammatory weight issues cut out just cow's dairy and lose 12 pounds. That's the only thing that they say they did, and they're just like, I just cut out A1 dairy and I lost 12 pounds. So it's different for every person, and I think sometimes, I actually a lot of the time, you just have to go with an empiric approach and start trying things on yourself. It might not be possible to have someone come to you with an answer. This will work for you because you're a very bio individual. So I think it's worth accepting that and trying to experiment and observe. Now, the low-hanging fruit, so to speak, are sugar and processed food, processed seed oils. Like I would start there. Yeah. And then progress on. But I think a lot of these problems, do have to do with
people always talking
with
hands and knees. Get the pain goes away almost immediately with the sugar.
Oh, for sure. I mean, actually, the canary in the coal mine for me, when I'm going out of ketosis, when I feel like I'm having some degree of inflammation, and the reason I never go full blown with gut issues generally is my knee. That I had a surgery on my right knee after doing some damage on it from running, and I have scar tissue there, and it swells up if ever I am a little too liberal with my carbohydrates and my ketones drop, because ketones are very anti-inflammatory. Okay. And so that's my canary in the coal mine. I get a little bit of rosacea, too, so I guess it's genetic. My face turns a little bit red, and my knee swells up, and then I know I'm like, oh,
That's
I need to
so
back off. I need to
amazing.
be a
That's
little more
exactly
conservative.
what happens to me. The
Yeah.
red face stuff. That's
Yeah.
amazing.
No,
Yeah.
people can look at me now and they know they're like, oh, Nick, like, my mom was like, did you have like too many blueberries or something this
Right.
morning? I'm like,
So
yep.
if you were to have 2 beers, you'd have the red face, huh?
Oh yeah.
Yeah.
Yeah. Actually, drinking was never something I really did, which I guess makes me in another way I'm a paradoxical person since I went to Dartmouth.
Right.
I never drank.
That's a drinking school. I get it.
I've never been I think I remember I've had like a one full beer when I was in Germany. I had a Guinness. I had a tequila sunrise on my 21st birthday because it was my 21st birthday.
Yeah,
I just
expected,
like
right?
I'll order whatever. It was nice and fruity, but I've never really enjoyed alcohol. I got drunk once, and I'll tell you why. This is a funny story. I had this Amarula. It's kind of like Kahlua. It's a South African cream liqueur.
Okay.
And I brought it up to school to share with some of my friends because it was the only alcohol I actually kind of liked. But as soon as I brought it up, and it's 32 proof, the school put in a hard alcohol ban. And I'm like, oh no, I can't get caught with hard alcohol. But it was finals week. So nobody wanted to drink with me. And I hate waste of any sort. It's like, crap, I have to get rid of this. So I drank it all.
Oh dear.
And that was the only time I experienced being drunk. And it turns out I am a very, very nerdy, tipsy person. I was going around, I'm like, Brant, this is one of my best friend's names. I'm like, black holes. Let's talk about black holes. So that was, anyway,
Typical, right? So you and I can nerd out forever, and I really appreciate you. I know you have a hard stop in a little bit. Tell the folks what question I didn't answer, what question I missed, and what, moreover, it blends right into what does Nick want to get out to the world now and in the future, and where are you with all that? And I know you've got the degree to finish at Harvard in med school and stuff, but I know that you have a website that is, we can do that after, your websites and your Twitter and everything, but
yeah.
About, you have a cookbook and stuff. So, but anyway, tell the folks about what the 40,000 foot view. What I always ask people, how does this play out in the next 10 years? And obviously you want to make an influence. I do too. But how does it play out in the next 10 years? How do you see that? And what part do you want to play in it?
Yeah. Well, first of all, for all the doom and gloom that people might hear about medicine, healthcare, our conventional system, where we are right now, I'm incredibly optimistic.
Good.
I'm enthused in large part because of the community that I see around me and people like you, where this message is getting out there. People are taking notice. This is a very, I think it needs to be a grassroots movement, but I think we're nearing an inflection point where people like me and people like a lot of people probably listening have suffered, gone through this transformation and realized this works. And the voices are getting louder and louder and louder to the point that the conventional system, and I want to focus on the system, not individuals, has to listen because this is so in your face now. Right. And a lot of doctors are switching their perspective. I can't tell you the number of really brilliant top tier people who I've seen shift from a more standard perspective to a, wow, this metabolic health, especially the low carb ketogenic stuff, it's actually really legit. And they start experimenting on it with their patients in themselves. Right. And they have these remarkable transformations and then, start practicing it. And not only do I see a lot of that transformation, but maybe more importantly, I don't see any of the reverse. I don't see anybody that's gone low carb as a physician or as a scientist, tried it out, and then been like, no, actually, I'm going to go back to my plate. That never happens. And so all the migration, the conversion is in one direction. I think that's a very interesting pattern and worth taking note of. In addition, I'm enthused because my sense is that my cohort, the next generation of doctors, is aware that what we're doing is not working. Whether or not you think my way is right or wrong, you can look around and be like, diabetes is on the rise, Alzheimer's is on the rise, whatever we're doing is failing. We need something else. And so people are looking for that something else. And every doctor that starts to try to train to be a doctor is going in because they want to transform health and healthcare for people. And so if this is provided as an option, if this becomes more prominent, people are going to gravitate towards it, including the next generation of doctors. And that's something that I want to help facilitate.
Nice.
To bring this to my peers at Harvard Med and elsewhere and say, look, this is interesting stuff. I get why you might be skeptical. I know that, you know, media around nutrition, it's really messy and you just want to tune it out and kind of just, you know, it's a hard he said, she said. I'm saying something that's against the maybe standard guidelines, but let's look at the literature together. Like, we're doing this case-based collaborative learning. Let's look at this case. And here's some papers that might inform how we might treat this case in a metabolic health approach. Just, isn't that interesting? What if we tried it? Like, let's just plant that seed. And I think as soon as you plant that seed, people, you know, will gravitate towards experimenting with this, because it's just, it's so fascinating. All the paradigms that are shifting, and there are things that I can't say right now about some of the work we're doing, like especially within like lipoprotein metabolism. But I'd say like over the next couple of years, there are going to be some mic drop, maybe next 2 to 10 years, some mic drop moments where we're shifting paradigms.
Nice.
And I think over a little bit of the longer term, metabolic medicine will be mainstream. I know it's frustrating and it's slow, and it frustrates me that it's slow as well, because I want it to just happen tomorrow, and I can't stand the suffering I see in people. But I do think that it's an inevitable future, because, and maybe this is my naive perspective, but I do think science always wins in the end.
Right.
And having looked at the science, I think it only makes sense to be treating the pandemic of metabolic diseases we are seeing today with a complementary metabolic health approach. And
Nice. That's beautiful.
and that's where I'm at. So yeah, it's a lot of fun.
You got Chris Palmer there, Harvard. He's been on our summit.
Chris
He's
Palmer,
really
David Ludwig. There are a lot of great people. I have a paper with Chris called ketogenic diets as a metabolic therapy for mental illnesses. I think mental illness is very interesting, and this is related to the food addiction stuff, because there's a lot of, well, there's a case series in binge eating disorder showing that like ketogenic diets are extremely effective for binge eating disorder. This is Carmen et al. People want to look it up. The reason I bring it up is because, and I don't think this is actually just specific to binge eating, but in eating disorders, and I classify food addiction as an eating disorder, there's this dogma: never tell a patient to have a restricted diet, because that's just going to mess up their relationship.
You're opening a gigantic can of worms that I would love to go down. Is you're right, 100%. But yeah.
Well, Anyway, what if this? Well, we don't have to go down that. I'm going to get myself in trouble. But I do think it's interesting stuff. Chris,
well, believe me, I get a lot of hate email when I talk about it, so don't worry. It will.
I don't mean to be an expert in this. I just think that the reason I pose these questions is because, not because I think we need to do it another way, but I look and I'm like, well, what we're doing is not working. What is the efficacy of current treatment for eating disorders?
Yeah.
Basically nil. Basically nil. And so, like, because nil is not, you know, what we're doing is not working, let's just like think out of the box, alternative approaches, because the alternative is people are going to keep suffering, and we have a sick care system, and nobody wants that. So let's just have an open mind. I
will. I know it's running time, but I will separate that. I've really enjoyed this thing from Bitten, where anorexia and bulimia are processed addictions like sex and gambling, but possibly binge eating, but definitely food addiction and sugar addiction is a substance use disorder. Biochemically, the folks cannot ingest this product without creating cravings and continuing to use, even though it's harmful. And that's like alcohol and drugs. So that definition, which flies in the face of the idea that, you know, if you're a binge eater and you cannot moderate, because they say if you demonize a food that you cannot moderate, you have to be able to moderate, or you're not well. That makes me crazy.
Yeah, I mean, the way I'd say it concisely is eating intuitively and eating in moderation. They're great taglines, and quite honestly, they're correct. They're the goal. They're the X marks the spot destination you want to get to. But the thing is, they're not the directions to get there. Saying eat intuitively is like saying go to this place, or like here are the directions to point X, arrive at point X. It's practically not helpful. And in order to get to a point where you can eat where you can eat in moderation,
Right.
you need to remove the obscuring force of the substance use disorder,
Yes.
so that your body's true hunger for nutrients can come to the fore, and then you can listen to it.
Yes.
And that's the powerful thing about ketogenic diets. It's not carb counting. It's the point where you could, or carbohydrate restriction, sugar restriction in general, the point where you can actually eat freely, even intuitively, and be liberated. So yes, technically you're restricting sugar, but in fact, I think it's a more liberating diet than anything.
Also, it comes to the definition of sugar. Is it a drug or is it a food? So eating, quote unquote, takes on a new meaning. Yes, the delivery system is your mouth, but it takes on a new meaning because it is actually a drug.
Well, sugar's not, you don't, one could argue you can't be addicted to something you need. Right. I would contend that. But even if that you want to hold that true, sure. Then let's say food addiction can't be a thing, like real food addiction. Yeah. But Twinkies, Oreos, sugar, they contain macronutrients. I wouldn't call them foods. They're edible substances.
Yeah.
They're in a different class. You definitely don't need sugar.
Right.
You don't even need carbs, but you definitely don't need processed sugar. Sure. And so I think you can put that in a category of, addicted substances. And I don't think, addiction, it's actually kind of hard to draw a strict definition. But if you have the parallels to anything else, I think sugar is one of the most addictive substances out there, all things considered, including the environmental aspect, because again, it's not stigmatized. In fact, it's held up and venerated in our society, quite frankly. So
Nick, tell the folks where they can find you online. I know you got an appointment. I don't want to hold you up for it. So tell the folks where you're going, or where you're at on the interwebs and Twitter and all those good places.
Yeah. So I'm most active on Twitter. My handle is @NickNorwitz. I pop into Clubhouse every now and then, which is fun. And I kind of have a YouTube channel. I use it infrequently sometimes if I have free time, which is getting less and less. I jump on my green screen and nerd out about a paper. And so if you thought I was nerding out now, that was nothing. So
no, it was very,
my video yesterday was on the twin cycle hypothesis of diabetes, which is very interesting. But if you like nerdy stuff like that, you can check me out on YouTube. And then you mentioned I do have a book, which I'll tell you why I wrote it. And so it's called the New Mediterranean Diet Cookbook, with my friend Martina Slariova. She's a cookbook author from England. We met at Oxford. I was doing it alongside my PhD. The reason I wrote it is for those people who are keto skeptics or who are having issues with their social circles or their doctor about wanting to try a carbohydrate restricted, sugar-free, potentially ketogenic diet, but facing pushback societally and maybe medically because of the stigma that still exists around ketogenic diets. So the way this book is framed up is based on what people think as generally healthy foods. The Mediterranean diet, the salmon, the leafy vegetables, and these aren't things that I actually would necessarily contest. I don't think they're absolutely necessary, but nevertheless, meet people where they are. And so what we highlight is New Mediterranean diet, and like a keto-friendly diet in the subtitle. So everything is sugar-free, grain-free, no artificial sweeteners required, and it's all focused on what people would think is a very healthy diet. You look at it, it's the avocados, the salmons, all the colors, and it just so happens everything is below 10% carbs. And I've had people go to their doctor, and their doctor is like, "Oh, this is great. Have this. Don't need a ketogenic diet," and they don't even notice that it's keto. Everything improves. So it's I think a good starting point for anybody who's facing that pushback, or if you have a loved one who's skeptical and you think that loved one needs to maybe try, then this is somewhere to start. And if it's a Trojan horse and they end up going carnivore, then fine. And if they don't and they love it, then fine. I think
cool. Where do they find that?
Just on Amazon, Barnes and Noble, wherever. We have a website that we're kind of getting up and running called newmediketo.com. Right. But yeah, if you just go on, you type my name in, Norwitz, New Mediterranean Diet Cookbook, it's there. Cool. And if you find it helpful, then I know we'd appreciate Amazon review.
There you go.
Say that. That's my plug.
Nick, thank you so much. I'll see you on Twitter and Clubhouse, and keep up the great work. And we'll talk real soon, man.
Thank you. Thank you so much for having me. And you who was patiently listening to my rambling.
No, it was awesome, man. Thank you so much.
Yeah, for sure.
Bye for now.
I was just, I don't know if that was, it'll be different, but that's my energy.
That was great, man. Don't worry about it. Thank you.
We hope you're enjoying all the speakers. We know that 6 or 7 speakers a day can be overwhelming with all the other things you have going on. If you want to be able to listen to all the speakers over and over again forever and get access to previous summit interviews as well as hundreds of dollars of sugar reduction bonuses, make sure that you click on the speaker package link to get lifetime access and make this the year you discover lasting sugar freedom success.